Welcome back to Mushrooms Chronic, but I'm Iconic. In today's episode, we're going to dive deep into the mission of promoting positive mental health and raising awareness about neurodiversity within marginalised communities. In this episode, we'll explore the importance of prioritising mental health, well-being for everyone, and ensuring that mental health services are accessible to all. We'll be discussing the challenges faced by marginalised communities when it comes to accessing mental health support and the impact the stigma can have on individuals. Join us as we shed light on incredible work being done to break down barriers and create a more inclusive society. To help us do this today, meet Elena, a passionate advocate for mental health and neurodiversity. Elena believes that as a nation, we should prioritize prevention and promoting positive mental health and well-being for everybody. They are dedicated to breaking the stigma surrounding mental health and raising awareness about neurodiversity within marginalized groups. Elena's mission is to bring about positive change and Elena's mission is to bring about positive change and ensure that mental health services are accessible to all. Mental health services are accessible to all. So, without further ado, let's welcome Elena. Perfect. How did you become involved in advocating for mental health and raising awareness about neurodiversity within marginalised communities?
So I
Wait a minute,
started, it's
sorry.
okay.
Do you mind moving your camera a bit down so your face is in the center, in the middle? Yeah.
Yeah, like this. Oh, let me get rid of that bin bag. Okay, clean shot. Right, let's see. I think that's better.
Yeah. Looks good.
Okay.
How did you become involved in advocating for mental health and raising awareness about neurodiversity within marginalised communities?
So I started working in care homes at quite a young age, and I was working with individuals who are neurodiverse, who also had physical disabilities as well. So it was quite challenging to navigate those physical challenges as well as their mental ability. So once I started doing my university degree as an adult nurse, I wanted to focus on learning disability, neurodiversity, and mental health. Um, and I recently myself as well got diagnosed with ADHD in the last year or so. So everything that I learned, I kind of applied to my own situation, and now I'm able to help people such as my cousins who are also struggling with the ADHD diagnosis or autistic diagnosis, or even like mental health conditions, like depression, anxiety. I am able to kind of support them and provide them the resources that they need because in our culture, in our society, in like most marginalized communities, mental health is a taboo, neurodiversity is a taboo. So I kind of want to be that push to advocate for the people that are silenced behind these labels.
So, what specific initiatives or projects have you undertaken to promote positive mental health and neurodiversity awareness?
So I took on a role with Mind, Swindon and Gloucestershire Mind. I worked with them for about 2 years, and we did community outreach projects. So we did an event called Time to Talk Day, which is where we put up a stand at the rugby stadium. Everyone, so carers, service users, companies, other mental health charities get together, and we kind of create a fun environment, a safe environment for people to come and learn about the different mental health diagnoses, the different neurodiversity challenges, just to get them the knowledge that they need to better understand their situation or to better understand how they can help their family members or other people in the community. So that is one example. I also do my own further development and learning. So I try to do a lot of certificates in mental health, like mental health first aid, autistic first aid, ADHD first aid, all that kind of stuff. And I'm in further education, so I'm doing my master's in mental health nursing, and I'm planning on focusing on advocating for like neurodiversity and marginalized communities with that as well.
That sounds so amazing. It's very much needed because it's such a taboo like subject. I feel like
Mhm.
mental health is non-existent.
Yeah.
It's like I feel like it's like have a like I don't know. It's like I don't think it crosses people's mind. It's like you're really exhausted
Mhm.
because you're burnt out because of
Yeah.
your ADHD because you're more likely to burn out. And congratulations on the diagnosis of
Thank
ADHD.
you.
Okay.
Yeah, much needed because I can kind of tell how much I struggled being at school. Always been known as the naughty one, the one that can't sit still, or the one that's too lazy, the one that's got potential but is too lazy to do their homework. And it is hard for women to be diagnosed with ADHD and autism because we have so many other issues that affect our the way that we do our daily activities, like our hormones. So it is quite difficult to get that diagnosis. So yeah, I'm quite proud.
That's good that you're proud. Can you share any personal experiences or stories that have shaped your passion for this cause?
Yeah, I think the major one that had major influence is the one with my brother. So he was diagnosed with ADHD and autism as a young person. So during primary school and secondary school, he had support, education learning support. He had EHCPs. He had all the support that he needed. But once he turned 16 and he left secondary school, all that support stopped immediately. So there was no support for him to kind of go into college to get that help as well. And at the time, I was young, and my mum doesn't speak the language, so she had no idea how to kind of get him that support as an adult.
Mm.
And so he kind of got lost in the system, which resulted in him self-medicating on alcohol and cannabis because of his ADHD symptoms. And he got in trouble with the law because he doesn't understand society. He doesn't understand some things that he does is wrong to other people. And so that got him in trouble with the law. And he developed psychosis, drug-induced psychosis, because of the amount of cannabis and alcohol he was drinking. And so, with him being unable to advocate for myself, advocate for himself. I kind of took on that role to be his advocate, to be the person that needs to speak up for him so he can get the right support. And it was a 3 year long fight to get people to listen to us, to listen to me, to listen to him, to be like, he's not ill, he hasn't got psychosis, he's not a threat to anyone, he's just been lost in the system, he's got ADHD and he's got autism. Um, and yeah, after a 3 year long fight, he is now doing so much better. He's off alcohol, he's off cannabis, he's in supported living, and he's trying to get back into college, trying to do his education, trying to better himself. And with these kinds of stories, you see it a lot of the times. Like for example, the Oliver McGowan story. He
Yeah.
was autistic, and unfortunately, the way that the healthcare professionals did not understand how autism is presented caused his life essentially. So it is essential for us to kind of attend these awareness, attend training, and try to take accountability as well to do the own learning by ourselves. So it's quite important. And I think with Oliver McGowan and also my brother's kind of situation, that's kind of what got the ball rolling.
Mm.
Um,
I feel like, often people, what I find is one of the negative aspects of the healthcare system is that they medicate as a first resort. I
yeah.
understand medicating as a first resort if there is become unmanageable for the person and it's detrimental to themselves as well as other
Mhm.
people. But I do not understand, without understanding what's going on, just giving medication. It,
Yeah.
it's like it's like, it's like saying, okay, this could be cancer, but we're not sure. But let's just start you on chemotherapy.
Yeah.
You need to be sure before you start stuff like that.
Exactly. Yeah.
And it's like, and it's like, and the same thing should apply to
Mhm.
conditions that are natural variants of the brain,
Mm.
and like mental health conditions as well.
Yeah.
I feel like that's what people don't realize is that quick simple solution
Mm.
is quick but is dangerous.
Hmm.
Like,
Yeah.
Oliver, like your life is could be at risk.
Yeah.
And you should never take that chance if the risk is not high. Do you understand what I'm
Yeah.
saying?
No, I completely get you. Yeah. And we're at a point where healthcare professionals, I think they just treat the symptoms instead of treating the root cause.
Mm.
Sometimes some people may take on antidepressant and antipsychotics very well, but unfortunately, in Oliver's case, they caused him his death. So I feel like, yeah, you need to investigate the root cause for them to be sure exactly what they're going through, what needs treatment. Do they want to go to the medication route? Do they want to go through therapy? Just getting that personalized approach, really. And it's hard for autistic people and any neurodivergent people to get the same level of care as a person who isn't neurodivergent. It is very difficult.
And I feel like it's like one thing that I can relate to your brother about is ending a lot of us with neurodivergence we always have a high chance of ending up in the criminal justice route.
Mhm.
And I feel like it's absolutely is I understand there's actions for consequences, but when somebody in that moment does not have the capacity to understand what's going on,
Mhm.
it's and they're in a moment of distress, they're in crisis,
Yeah.
and that is completely disregarded,
Yeah.
and they're like handed either with like a suspended a sentence or what prison time, whatever it may be. But I'm
Mhm.
like, okay, they're gonna be locked in or they have to follow these rules. But how are they getting better? What guarantee is sending someone to prison or having a suspended sentence, whatever the sentencing is, that they won't end up in the court within the next 6 to 12 months?
Yeah, exactly.
How do you believe that promoting mental health, positive mental health, can benefit marginalized communities on a broader scale?
Mm. I feel like with the lack of conversation around mental health in majority of the marginalized communities, once we start having those open conversations, we can be the generation that kind of um, changes the idea of what mental health is. Because the previous generations, without that conversation, there is a lot of taboo around mental health. It's either it doesn't exist or it's something else. You're disobeying your parents. God is angry with you, you're possessed. So mental health is non-existent really. So as our generation, we need to start that conversation and be like, hey, it's not this, it could be this, and it's okay to feel this way. It's okay to want to get help. You're not a bad person for wanting help. You're not a bad person because you're feeling this way. And we need to take that accountability to say it's enough now, because if we don't start that conversation, our children are also going to have a hard time accepting mental health conditions, even if they do go through depression or anxiety. At least then they'll have the resources that they need and the support from family members, friends, society to be able to better themselves. Because, you know, having these mental health conditions, having these labels, it is hard to carry labels around, especially if they come with a lot of stigma and a lot of judgment from other people. And the majority of the people who have never had a mental health condition or any neurodivergent condition, they don't understand how difficult it can be for someone who does have a mental health condition. They don't understand how it can impact their daily activity, their moods, their relationships with themselves and others. So starting the conversation, I think, is the biggest way to start, promoting. And it is going to be a massive impact. It's always going to start with us. Um, yeah.
What are your what are some of the biggest challenges that you face in your advocacy work, and how have you overcome them? Or if you have not overcome them yet, how are you planning to overcome them?
Yeah, I haven't overcome them yet. My main challenge is the Muslim community, trying to have awareness. So I've tried many times to get myself into a local mosque to do a talk around mental health. And I've always had pushback around it because it's either, oh, we don't believe about mental health, oh, nobody cares about that, oh, you just need to read the Holy Bible or the Quran and you'll be fine, you just need to pray more. So it's really hard to get the older generation to understand that just because you pray 5 times a day, you read, you do all your religious duties, you can still have mental health issues. That doesn't mean you're a bad person. That doesn't mean you're not religious. And I do struggle to kind of raise awareness around the Muslim community. And I do plan on fighting back a lot. I do plan on going to other local mosques. I do plan on doing awareness like weeks during Ramadan because the fasting month is coming. So I think it'll be good to kind of raise awareness that way over Zoom, over LinkedIn posts, just so I can at least get into one local mosque, do an event. The children are there, families can be there, and just target that audience because our mental health is really low and we have a higher rate of men committing suicide in our Muslim community, but no one speaks about it because everyone is either embarrassed because their family member committed suicide or their family member had depression. And it's really not nice to kind of hear that word embarrassment. It's something that they had to go through. And it's sad that they had to take their own life because they didn't have the right support. That's a major challenge that I'm having.
I feel like it's often upsetting when people care more about reputation, honor, what other people think. I feel like a lot of ethnic and marginalized communities have that mindset. It's like, what would other people think?
Hmm.
Who gives a fuck about what other people think? Like,
Yeah.
honestly, who does? If your child, but and the thing is, that's generally the first concern is not about, oh my God, how much pain is this person in for him to go kill himself?
Mm.
No, it's look what he brought on us. He ruined our reputation. He left us to deal with his problem.
Yeah.
And I feel like another person who's really good and is trying to do like a similar thing to you is Fahima. I don't know if you know her. What the fuck?
Is she the therapist?
Yeah.
Yes, I love her. Yeah, I got her. Yeah.
She goes in live and I'm like, oh my God, this is great. I think she's trying
Yeah,
to do it
she's
every day for months.
amazing. Yeah.
And I feel like even if hundreds and hundreds of people were to get together, I feel like the mindset is so rigid
Hmm.
and it is hard to change.
It's hard. Yeah. And
And
even if you have children who understand mental health and they want to access therapies, parents are going to hold them back because they'll be like, why are you going to therapy for? Why can't you talk to me? You're just going to talk bad about your mum, or you're just going to talk bad about your family members. And it puts them off from going to the therapy, or they go to therapy in secret and they're not getting the full um, reward of being in therapy because once they finish their session, an hour session, they go back home and the whole abuse starts again, mental abuse starts all over again. So they're not really benefiting from it.
mm,
It's difficult.
I feel like it's it's the willing. I feel like people's people need to be willing to change for change to happen.
Yeah.
And I
Amen.
feel, and I feel like if that's I feel like that is something that people need to work on. And before we go jump into mental health neurodiversity, you need to be willing to change.
Yeah.
Your willingness not to change is much more stronger than your faith in anything.
Yeah.
I feel like a lot of people is that they're so stuck in their mindset and not wanting to change, and they don't know how many things they are putting on the line because of their
Hmm.
mindset.
Yeah.
Your relationships with the people, like healthy relationships, not just like oh, I call her, and she's still there with me. And like and the thing is, the only person that is going to affect in the long term because of their willingness not to change is that person.
Mhm.
Is because your daughter might turn back and be like I know my parents, the, they're probably like, oh, we wish we could see our daughter being me, but they can't because I won't.
Yeah.
That's like, and that's the stuff like that is the things that you're willing to risk.
Mhm.
So, what do you think?
Yeah, I completely agree with the situation because you have to be the change that you want to see in the world. You can't be a hypocrite. You can't be advocating for mental health and neurodiversity in your own community if you don't accept it yourself. If you don't accept that in the future or in the past you went through some sort of depression or some sort of low mood, you need to accept, you need to learn from it, and you need to be the change that you want to see. So I completely agree with you.
Definitely. How can a focus on prevention in mental health contribute to overall well-being and quality of life for individuals?
Prevention is key to mental health, to physical health, spiritual health, to every type of health that you can think of, because everything, every illness, every disease is preventable. And once you get to that root cause, then you can kind of work with that person to kind of um, limit these circumstances, limit these triggers, as we call it in mental health, to for them to be able to understand that when it does happen in the future, they've got the resources to be able to stop a reaction from happening, whether if it's, for example, if someone has a trigger and it caused them self-harm in the past, when that trigger happens in the future, they're able to kind of understand, I'm feeling this type of way. In the past, I would have gone straight to self-harming, but I'm just going to sit with the emotion. I'm going to reflect and I'm going to choose a healthier behavior instead of self-harming. And when we start thinking like that, preventative measures, we start creating a pile of resources that these people can use to be able to keep themselves safe, keep themselves I'm not going to say happy because I don't like that word, just because
Content?
you've got, yeah, content. Yeah, yeah.
What are some specific strategies or approaches that can be implemented to promote positive mental health and well-being for everyone?
Yeah. So majority of the approaches and preventative measures, they should be person specific because everyone is different. Some approaches and mechanisms might work better for others, and some might not work at all. So when I always did well-being support for my clients, I would always do like a risk assessment, a goals assessment, and kind of see exactly what they want to achieve with their well-being support. And then we would go through all the resources that I can think of that I've made personally or that I found on the NHS website. Or on the Mind website, that's a good one. They've got really good resources. And then we compile like a well-being box. So anytime this individual would feel a negative emotion, they will go to the well-being box, choose an activity, choose a soothing toy, or choose a music, choose. So it would have different sensory things in it. And so when they are having this negative emotion, they will go into the box, pick something up, and instead of feeling that negative emotion, they would feel it, sorry, but they would put the energy towards doing something positive rather than doing something negative. And I always say it has to be person specific. Um, but like Mind has got a lot of stuff. The NHS website's got a lot of stuff. Yeah.
I feel like the one thing that counts should always be if there's only one criteria that you can pick,
Mm.
from all the criteria that can be, the one thing that let me re-say that because that doesn't make sense. I was like, I feel like if you could pick out all the criterias, only
Mm.
one to have, it should always be bespoke care. Care should always
Mm.
be bespoke and tailored to the individual.
Yeah.
And that's so important
Yeah.
because
100%.
one size does not fit all.
Exactly. Yeah. And you might have someone who is content with being offered a cup of tea to take their mind off something bad that happened early in the day. Another person might just look at you and be like, do you think that's going to help me? Or do you, like, what's a cup of tea supposed to do? You know, so you need to take them as individual people because they are individual people and they have individual ways of being in need. And yeah, bespoke care.
Definitely. What are, I mean, think about how I'm going to phrase this. In what ways can prevention initiatives reduce the prevalence of mental health difficulties within communities?
Yeah, so with prevention, once we know the cause of mental health concerns with individuals, we know how to tackle a same situation in the future. And so we would have resources to be able to prevent them from having um, from either relapsing into a mental health condition again, or just for them to kind of successfully lead a content life and a safer life for themselves. And there are resources as well on the NICE, and there are some statistics by NICE, a lot of NICE guidelines. And they found that during COVID, so our mental health prevalence increased during COVID because of the self-isolation, and majority of the self-isolation was with elder community. And it was difficult because they couldn't go out to see their families couldn't go out to see them. And so that self-isolation kind of caused a lot of mental health diagnosis in that community. And now when we learn from it, we can prevent future elderly people in the community from going through similar things. So we try to include a lot of befriending services, a lot of um, befriending services could either be telephone or you can be visiting them. We try and include them in the community, so offer like little cafe outings or get-togethers in a community centre, and that kind of prevents the self-isolation and the isolation from community.
In what way can prevention initiatives reduce the prevalence of mental health difficulties within community? That's the question I said, right?
Yeah.
How do accessible mental health services play a crucial role in ensuring that individuals can receive the support they need?
I think if people know that the services are out there, then they're more likely to want to access them. But it is quite difficult to navigate these resources because most of them nowadays, because of COVID, they're all online. And a lot of people in the marginalized communities, they might have language barriers or they might have um, they just might not even be able to access the internet, or they might not be able to go on a computer to know exactly what to do to access these resources. So, for example, like the e-consult, if you want a GP appointment, you have to go online, you have to do the whole e-consult for you to get an appointment. And sometimes it's just easier to pick up the phone and call and ask for an appointment with a mental health nurse. But going through these processes of logging onto a computer, typing the website, filling in a 15-minute form, it is quite daunting for someone who is experiencing a mental health crisis and they want help straight away. And some resources are out there if you want help straight away, like Shout, the texting one, the crisis team. But these they can be hit and miss. These resources that if you want like a quick support. And so being able to adapt and amend the way people access the resources, it can make it easier and more likely for people to access them when they need it. Especially people with neurodivergent, people who have learning difficulties, learning disabilities, and just the general population, they would rather pick up the phone and ask for an appointment than to go through all these processes. And I think the most difficult thing as well is most of the mental health teams in the NHS, they don't really work collectively as a team. So if you go, for example, to the early psychosis intervention team, you would do a risk assessment with them. But then if they pass you on to a community mental health nurse, you would have to do another risk assessment with them. And so the process is quite repetitive and it can be quite daunting for people. They don't want to go through all the things, all the hurt that they experienced multiple times. They just want to do it one time, get the help that they need, and get the support in place. And so we have to get it right in the NHS, in the public sector, in the charity sector, in the third part sector as well. We have to get it right. Otherwise, we are going to see people not wanting to access mental health services. So I feel like if we get the right, if we tend to everyone's needs in the community, we hopefully we should see an increase in people accessing mental health services. At this moment in time, not many people are accessing it. We did have a high number of people during COVID, but after COVID, that number just plummeted.
What are some barriers or challenges that individuals may face when accessing mental health services, and how can these be addressed?
Yeah. So the most common barrier that we see is I'm not gonna call them patients. I think I'm just gonna call them service users. When service users are not taken seriously, if they are presenting some symptoms that are not normal for themselves, but the healthcare professional might see that as normal, they might dismiss their overall symptoms and not be like, oh, it's just because you had, I don't know, a tough day yesterday, or are you sleeping properly? Are you eating properly? You might need to lose some weight, or you might need to take some vitamin D, so the presenting symptoms for mental health is not taken as seriously as it should. And I see that quite a lot with the service users that I used to work with. And once they felt dismissed by a healthcare professional like a GP, that reduces the likelihood for them to try and access the service again, even not even the same service, other services as well. So that's one barrier is dismissive of symptoms. Another barrier could be language barriers, especially in marginalised communities. It could be barriers in accessing the resources. So sometimes GP practices have self-help resources on their websites, but they might just be in one language. They might not be in Braille. They might not be in different languages for different nationalities. And also another common barrier that we see is we waiting lists. So people want the help, but they have to wait such a long time to receive the help that by the time they get to the top of the list, it's either they no longer experience the symptoms, they've gotten worse, or unfortunately they they just don't want the help anymore. They don't trust the system. So those are the three main top barriers that we see in people accessing services.
How does the accessibility of mental health services contribute to early intervention and better outcomes for individuals?
I always say this, if people know where to go to get help first, then we can prevent so many issues. We can prevent so many other complications in the healthcare. And it's quite unfortunate to see, I'm going to use the Oliver McGowan example again. It is unfortunate for him and his family to have, have had experienced this because his autistic presentation was not, nobody had the training to kind of spot that. And so he wasn't able to access the right service for him. So at first, they sent him to a general hospital instead of a mental health hospital, or they sent him to a general adult ward instead of a ward where learning disability nurses work there. Because if that was the case, they would have spotted Oliver's autistic traits and said, hang on, he is presenting this way. This is his normal self. He's not being agitated. He's not being violent towards anyone. And so having the right training and having the right access to the right resources is quite important because we don't want to send people to um the wrong team because it does happen. You see it, people are referred to teams where they don't know what to do with them, and then that they lose hope. It's not nice getting a letter or getting a phone call saying, "Oh, I don't know how to help you. You go somewhere else," kind of thing. It is quite difficult.
How does the availability of culturally sensitive and inclusive mental health services contribute to accessibility?
So at the moment, where I used to live in Gloucester, there was no such thing as cultural sensitive, cultural adaptations, just not a lot of the services. So we only had one major hospital, the Gloucester Royal Hospital, and their training is not cultural competent. So most of the nurses and the healthcare professionals, they don't understand how they need to tailor their care and their support to individualized people. And in Gloucester, we have a large community of Asian and African Caribbean individuals. And so having to kind of tailor and make that care person centered, it is quite important, but they lack the training in spotting these cultural differences, even asking someone if they prefer something a different way than another way. Um, and where I live now in London, it is quite difficult because I had to get my injections, immunizations, but no one thought to kind of let me know that one of the injections had pork in it. And being a Muslim, I can't have anything that's derived from pig. And so if that conversation was given to me, like I'm visibly Muslim, I'm Muslim. It says on my chart, you know, if the healthcare professional at the time had the knowledge of the Muslim people did not eat, drink, or touch, or anything to do with the pork derivative products, they would have known not to give me that injections. And when you're having someone as authoritative as a healthcare professionals, it is hard for you to speak up for yourself. And it can get scary and quite daunting to be like, hang on, what's in this ingredients? What's in this tablet? What's in this injection? So if healthcare professionals do have that training, cultural sensitive training, it can stop barriers for other people to access healthcare.
And how did it make you feel that they didn't realize it was deprived from pork?
Yeah.
And how did like did that impact you in any way? And how did you find out it was?
So it was one of the COVID vaccines. So I had to produce a certificate of COVID to my university before I go into placement. And I just off the bat just Googled the brand because I don't remember. I thought I had the AstraZeneca, but in the end I had something completely different. And when I Googled the brand and looked at the ingredients of the injection, it had pork in it. And it was just kind of it was my own curiosity that led me to find that I did. It's a bit too late now for me to kind of go back to my GP and be like, why did you give me this? Why did you do that? This was like 6 months ago when I had the vaccine. So it is a bit too late for me and it's already in my system. I can't do anything about it. Um, but yeah, if now that I know I can kind of prevent it for my own community, I can be like, you can go for this vaccination if they offer you this vaccination, don't take it. You can ask for the alternative, the AstraZeneca or the Pfizer one. So
Hmm.
it's yeah.
What role does policy and government support play in ensuring that mental health services are accessible to all individuals?
Yeah. A lot of the issue at the moment that we find is funding from the government. Unfortunately, the last charity that I used to work for, their funding got pulled back, and so all the good work that we were helping with people during COVID with telephone wellbeing support, in-house support, befriending services, all that just had to stop out of the blue, out of nowhere, and we unfortunately had to send emails and phone calls to over 600 people on our list to say, we know that you've been on the waiting list for 2 years, but unfortunately we don't have the funding to continue this anymore. And those 600 people, for them, is either life or death. They need the support. They needed it since COVID, imagine. And it is quite difficult for them to be on the waiting list for such a long period of time in hopes of receiving a service and then in the end being told, no, you're not getting this service. And policies needs to be in place for mental health services in terms of how we approach people who are kind of displaying mental health conditions. Sometimes people abuse their power in the healthcare system. And so, for example, I've seen quite a lot if people who are diagnosed with EUPD or BPD, they are kind of seen as the enemy in the mental health world. And so people abuse their power with either um, handling them too much with like MAPA training um, and just not treating them as humanely as they need to be, just because they have this label. And yeah, I just feel like we need more training. We need more training, we need more awareness, and we need more funding.
How can collaborations between different sectors, such as healthcare, education, and community organisations, improve mental health accessibility?
Definitely. We've seen a massive improvement in our new nurses who have recently graduated in the last 10 years, because we've before over 10 years ago, so our adult nurse training didn't include an element of mental health nursing. So you would either have to do adult nursing to be trained as an adult nurse or mental health nurse to be a specific specialized nurse. But now that we've included elements of mental health nursing in adult nursing, our nurses go in towards with at least some background information to be able to handle situations if they do arise. And so they're not left, just standing there when someone is having an emotional um, breakdown. If someone is having like a very difficult day, they do have the skills and they are equipped to be able to handle that situation. And we've kind of seen the increase on mental health first aiders training as well in the workplace. It is really important. So it's not only in healthcare workplaces now, we see mental health first aiders in offices, in the gyms, in majority of the workplaces that we see. And it is quite important to have those there because everyone experiences mental health issues. Everyone, you don't have to, be a specific type of person to have mental health issues. So it is a good thing that we've seen a rise in mental health care education, and a lot more people are taking mental health first aid quite seriously. So there is support there if someone was having a difficult time during work. Um, yeah,
Amazing. I feel like mental health first aid training is so necessary.
yeah, it needs it, definitely. And with my uni accommodation now, our building manager was not mental health first aid trained. And I was a bit suspicious because you work in a uni accommodation with students who are doing really long degrees, really difficult degrees. There are in they are going to go through at some point of their degree a mental health condition, whether it's depression, whether it's low mood, whether it's anxiety. So it is important to kind of have that training. Luckily, I got him trained, so he is a mental health first aid now, and we've kind of got that support in place for other students around in the building.
That's amazing work that you're doing. Can you
Mhm.
discuss the long-term benefits of investing in prevention and accessibility in mental health, both at an individual and societal level?
So, as an individual, the positive impact on prevention is immense because once we learn how and why this individual is going through a certain mental health illness, we can, as I said before, we can implement strategies in place to be able to support that person in the future should they go through something similar again. And also they've got the resources themselves to be able to support someone else who might go through something similar, either a family member or a friend or even someone in the community. So it's like a ripple effect. We help one person and that person can go on to help another person. So it is prevention is quite important. We see it as something small, even in the physical health. Um, Prevention is not taken as seriously as it should. A lot of illnesses can be prevented. And when we focus our education on prevention rather than masking symptoms, um, we can, as a society, we can have a better and healthier groups of individuals as well. And we can potentially see the prevalence of mental health concerns lower in the future if we start to focus on prevention rather than masking symptoms with medication.
What How does the intersectionality of neurodiversity and race influence experiences and challenges faced by individuals in marginalized communities?
Oh, it's so difficult for individuals who label themselves as neurodivergent um or if they come from a marginalized community, they have a lesser they have a lesser chance of them successfully accessing and completing a mental health course of treatment because first of all the stigma starts there. The stigma comes from within themselves or within their own community, and then once they pass that hurdle of stigma and they want to access the support, they're put on a waiting list, and that waiting list can be 3 months, 6 months, a whole year. And being on a waiting list for that too long, it can kind of put them off from wanting to the accept the what's the word I'm looking for? Accept the support when they do get to the top of the list. So whilst they are waiting on the waiting list, they have, the background of their own community saying, why do you need to do that? Why do you feel this way? Just go pray or just go give to charity, just be nicer to people. It's not nice having all these words being thrown at you when you are going through something that sometimes people don't understand. They might not want to understand because they don't believe in it. And it is important for like yourself and myself that we are having these conversations and we are making them available for people to access to let them know that it's okay. It's okay if you want help, and it's okay if you are going through depression, if you are going through anxiety. It's okay you have ADHD. It doesn't make you a bad person. It doesn't make you a bad individual. It doesn't make you not normal. And it is hard. And I think the biggest um drawback in accessing support is the stigma in the community. Once we'll never abolish stigma, but once we kind of get an understanding in the community that it's okay for for our children, for our people to get help, then we've done the right thing.
Can you provide examples of how gender identity intersects with neurodiversity and how this intersection impacts the experience of individuals?
Mm. I read somewhere that people who are neurodivergent are more likely to experience conflict with their gender identity. Um, and there was another study as well that said people who are fluid in their gender are more likely to be neurodivergent. And when it comes to gender fluidity and also being neurodivergent, those are two big major labels that in society people are not going to understand. They don't understand gender fluidity. They don't understand neurodivergent. So if you've got a person who's got both labels, it becomes difficult for society to kind of understand where they are coming from. And so if society are kind of being discriminative and discriminative within this person, they themselves do have an internal monologue of conflicts. Who am I? Am I neurodivergent? With my gender fluidity, who can I be? And sometimes with being neurodivergent, you do have um, fixations. So they might mistake their gender fluidity as a fixation, and they might go through ups and downs with their gender fluidity. So it is quite difficult to be of both communities and to be able to manage that effectively.
In what ways does socioeconomic status intersect with neurodiversity, and how does this intersection shape the opportunities and challenges faced by these individuals?
We've seen a lot of, in education, we've seen a lot of research and studies showing how socioeconomic status can impact an individual's mental health condition. And the lower your socioeconomic status, the higher the risk of you developing mental health condition, specifically depression, specifically anxiety as well. And there are so many factors in play when it comes to socioeconomic status. And in this day and age with COVID, a lot of people have lost their jobs. A lot of people have kind of fallen down that socioeconomic ladder. And we've seen, because of that, we've seen a high number of rises of cases of depression and other mental health illnesses diagnosed. The NHS has seen over, I think they said it's either 50% or 60% of increase in mental health diagnosis in the last 2 years. And that's due to COVID. Um, and there are many reasons why, and one of them is the socioeconomic kind of status. What else would the question say?
You answered the question.
Okay.
What are some specific ways in which systematic inequalities and discrimination can compound challenges faced by neurodivergent individuals who are part of a marginalised community?
Yeah. So it's difficult to be from a marginalized community anyways, especially if you are neurodivergent too. So like I said, having two labels is more difficult than one, because people can either treat you as neurodivergent or they can treat you as someone who's Black or Asian or Afro-Caribbean or, one or the other. And putting those two together as a collective, as your identity, it can be difficult to navigate a workplace that isn't willing to accommodate your needs. So we often see some of the clients that service users that I work with, they do have difficulty with getting what's the word, adjustments for their ADHD, or adjustments for prayer times, for example. So a Muslim lady that I work with, she's got ADHD and she's a Muslim as well. So she needs to take time off at certain periods of the day to go pray, just 5-10 minutes. But she also needs to take time off in between meetings because she cannot sit still. She cannot sit still for during like a 2 hour meeting. She needs to stand up, do something else, and then sit back down. And so if a employer sees, oh, why does she need to take so and so much time out of the day, this is gonna impact the amount of work she's able to do, it's gonna impact everyone else, it's gonna impact the team, it's also going to impact payroll. Why am I paying her this much when she's only doing this much of work? So it is hard to be your own spokesperson, to ask for these adjustments, because the employer will see, oh, you can either have one or the other. And that shouldn't be the case. They are responsible to making adjustments for you as an individual, so you can have the same opportunities as someone who is not neurodivergent, as someone who is not from a marginalized group, to be able to do your work effectively, but also make sure that work doesn't impact your own physical or mental health as well. So it is difficult.
And if the one amazing resource that the UK has is access to work, where you can
Yeah.
get up to £66,000 in accessibility requirements being put into place.
Yeah.
It could be physical, emotional, and mental, as well as cognitive and neurodivergent conditions.
Yeah. But
In
it
what?
is hard for, sorry.
It's okay.
It
Go
is
for
it is hard for individuals who come from certain backgrounds to receive that access to work. I've seen a lot of applications being made on my behalf to my service users, and majority of the time I see a certain demographic getting that access to work funding, and then another demographic completely dismissed, not getting it at all. And the main factor to play around to play the main factor of that decision is not because of their neurodivergent, but because of where they come from and the job that they're doing. So it is a discriminative process, and it is difficult to navigate kind of the workplace if you don't have the access to work. So either way, you still need someone to kind of advocate for you if you need it.
In what ways can advocacy efforts for neurodiversity and social justice intersect to create more of an inclusive and supportive environment for individuals in the marginalised community?
The more we speak, the more people are going to hear us. As simple as that. We need people to hear us, because it's too late for our parents, it's too late for our grandparents, but it's never too late for us. We need to be that start of the domino so our children can continue that ripple effect to their children and their children to their children, because we need to kind of abolish, I say abolish because it would be nice to get rid of stigma, but it's not going to be easy and we might never get rid of it. But the more we talk about it and raise awareness, attend conferences, do like you do, post on LinkedIn, post on TikTok if that's kind of your vibe. Follow follow other influencers who speak about the same thing that you want to raise awareness, like Fahima, therapist, networking events, and just trying to get the word out is the most important.